Offering flexible working opportunities is a great way to retain staff. Different flexible working arrangements are appropriate for different roles and different people. And if that arrangement suits you and the service you're providing, then it can be really beneficial for personal job satisfaction, for engagement with your role, and general work-life balance.
District Nursing Service delivers care to patients in their own homes. We do a wide variety of things from diabetic care, wound care, catheter care, end-of-life care.
Our service traditionally has run from 8:45 until 5 p.m. We have one member of staff who works from 7 in the morning just to cover when the evening shift ends, so any urgent calls before the normal day shift starts. But effectively we are more of a 9 to 5 service, aren't we? There was loads of reasons why we initially decided to start looking at flexible working. Partially down to retention of our staff. We were seeing some of our staff move to other teams because they wanted to work longer days and have more days off. Partially down to recruitment. We were recruiting staff who were then saying to us after interviews and being offered posts that they didn't want to do our shift pattern. Partially down to the NHS toolkit and the Q&I workforce standards saying we needed to look more flexibly.
A lot of staff reported as well they were working long hours into the evening, unable to fit their working day into the hours that we were providing, so we wanted to look at what we could do to accommodate that and retain staff with experience.
It was about work-life balance really, wasn't it? And about flexibility for our staff. Because community nursing have always really rigidly worked standard day shifts, like 9 to 5 kind of shifts, and we wanted to be able to have something a bit different. We trialled it in your MIA team, which at the time was quite well staffed, quite stable staffing, and in a team in Newcastle that had got really unstable staffing and very high levels of long-term sickness, which gave us a good overview of how it would work. Because if we were conscious, if we just tried it in the well-staffed teams, we wouldn't know how that would pan out if we then had a lot of sickness. So we needed that contrast to be able to say, well, it works when we staff, but does it work when things are really pressured and actually the demand's really high? And actually we could say at the end of it, yes it does, because it worked during the trial. We've got some staff who have got specific flexible working agreements in place to allow them to have set days off or set days in work, so they can arrange their lives around that for whatever reason, whether it's carer or childcare reasons or another reason altogether. We've got agreements where people work less hours or might have a routine over what weekends they can and can't work or how many weekends they can and can't work. But it's always had to be within the realms of our service operation and shift times. And we were already seeing some of our staff were feeling a bit burnt out, so we didn't want to add anything in that was going to make it worse. And that was why we didn't look at 12-hour shifts as well, really. But a 10-hour shift worked well. We'd already got staff starting at 8 a.m. and who were working till 6. So to formalise that didn't really feel that different. We looked at risk as well. So there's lots of risks associated in community being lone workers anyway. So we looked at any increased risks associated with flexible working if we were to extend the shifts. So only having one member of staff out till 6 p.m. was quite a concern, wasn't it, if that was ever to happen. We met with HR as well, spoke to them about the process of introducing the shift pattern and how that would look. And because we weren't taking anything away and it was purely voluntary basis, there was very few hoops to jump through from a HR perspective. It was just about making sure the staff were consulted with and there was a process for them opting in or opting out or changing their mind, how would that work. So we looked at that, and then we linked with the health roster team as well to make sure the rotas could be adjusted to work for our services.
We ran it as pilots in our respective teams over 8 weeks, and we sent surveys out to begin with to the people that wanted to opt in, and then we did a 4-week review, and then at 8 weeks we reviewed it again, and the feedback was really positive.
And actually your MIA team never came off it, so the trial officially finished the week before Christmas, and your staff had all of their Christmas rotas reworked at the very last minute because they actually wanted to stay on it for Christmas. We looked at our KPI data, so sickness levels, performance data, we realised that staff who were working the equivalent number of hours, be it on the longer or shorter shifts, were doing the same number of contacts over the week, which meant that it wasn't increasing anybody's workload, and it was operationally viable because we were still seeing the same number of patients throughout the working week as we were pre-trial. I looked at complaints and incidents, didn't see any changes in the trends there, didn't see an increase, so we felt safe to continue it on. We ended up putting an FAQ guide together with lots of the questions we've been asked and a big table about if you do 30 hours, this is how it looks, if you do 22.5 hours, this is how it looks. So it was really transparent that people could decide before we rolled it wider, what does it look like for me, is that going to work, should I do it? We were really open with them because I found that's always the best way to engage staff, to be honest with them. So we had open discussions, didn't we, in handover and team meetings around what this trial might look like. But we engaged with them, didn't we, about in handovers, in supervisions, in team meetings, sent out lots and lots of information and the initial questionnaire, which was just getting people's thoughts before the trial started, and who wanted to opt in and who wanted to opt out. And there really was no pressure either way. It didn't make a difference to us. It's about improving what that staff member's experience was. And then we also managed to do a separate questionnaire for our senior nurses to gauge their ideas and thoughts about it and how it was impacting them as the people who were basically managing the shifts and putting the rotas together. The biggest surprise for me was when we put all the surveys together, the range of reasons why people were giving as it having benefited them. So all staff said it benefited them, but actually there was such a variety of reasons for that. So some staff cited it was helping them maintain their physical health, them giving them extra time to go to the gym. Mental well-being was a big one. Carer responsibilities, childcare. There was a real kind of range of reasons that people were saying that is specifically how it's benefited me. There was this significant perception in the fact that work-life balance had improved considerably just as a result of adjusting the shift times. People felt they weren't doing as much unpaid overtime, but they were still doing the same amount of work over the week. So that was huge, and I think that is what created so much excitement from the surrounding teams as well, because they suddenly felt like, oh, this is going to make our lives better. And it was really quite a small change, to be honest, in the grand scheme of things. In fact, we only had one person come off the trial throughout the whole process, and that person was really positive about it. It just wasn't quite the right timing for them, and they've gone back on it since because things have changed for them. We had a perception, and this is why it hadn't been done sooner, that it was going to be really difficult. And actually, we found out it was really quite straightforward. And because we were adding something extra in and it was being offered as an option, it really was easy to do. And HR were really happy with the process. There wasn't like any hoops the staff had to jump through. It was just a yes, I want to do it, or no, I don't. And I think that's been really positive. So for me, my advice would be just start looking into it and start making those steps, because it won't be as difficult as you think it will be. Pick a good chunk of trial period. 8 weeks is a good length of time, 2 rotas to kind of get the teething issues out of the way and then see how it actually looks and feels.
This example of flexible working arrangements with the community district nursing team at MPFT is a really good example of flexible hours being offered to clinical staff.